What do you think you would tell your, 20 or 30-year-old self that you know now?
Probably not to worry. I probably spent a lot of energy on worry, and I think we all know that that's a future thought. And so getting your mind back to, how do I be here now?
Yeah, I like that. I like it a lot. Hello, and welcome back to HERology, the Mount Sinai Health System's new roundtable video podcast dedicated to women's health and wellness. I'm your host, Joanne Stone, an OB/GYN here at the Mount Sinai Health System. On this episode, we discuss the opening of the Carolyn Rowan Women's Health Center, what inspired it, why is it so necessary, and what do women gain from having this kind of comprehensive care center at a place like Mount Sinai? To walk us through this incredible journey, we're joined by Carolyn Rowan herself, a renowned designer in her own right, and a trailblazer in philanthropy. We're also joined by our co-hosts, Dr. Leslee Shaw and Dr. Anna Barbieri. So welcome to the show. All right, Carolyn, I have a question for you. Okay. So this commitment to Mount Sinai is huge. And so can you walk us through a little bit about why you're so committed to Mount Sinai? Like what's your history behind it?
Sure. So I was born at Mount Sinai, and at the time it was called the Baby Alumni Club. I don't know if they have that anymore. Yes. And then it just felt like a natural place to give birth to our 4 children. And it was a really awesome experience when I think about you're nervous. It's a hard experience. You don't know what to expect. And each time, the nurses were really incredible. My doctors were great too, but the nurses who you spend so much time with while you're being prepped and you're getting your medication and you're lying there and you're like waiting for something to happen. And the aftercare was great too. Yeah. So I have a natural loyalty to the hospital that did so much for me.
I think that's so, like we see that all the time. I think people that have children here and then really that you have the rest of your health care often in that hospital where you gave birth, or you send your kids or your family, your husband, your mother to that hospital. I mean, I think that's something that we see, all the time. So I know something special about giving birth. I mean, of course, as an obstetrician, I think that, but, I think
that's really true. Women are often the entry point to healthcare for their families. It is, after all, women, and often, especially if someone has children, they are the ones handling healthcare decisions. So I think experiences like that really, really matter.
Right. I think it's a natural feeder to the pediatric board.
Yes, that's totally true.
I think the OB experience also often colors how a woman will perceive her care later on in life. It's often the first time that somebody gets hospitalized. It's often the first kind of up close and personal experience with a healthcare team.
There's this old adage in medicine that the more your care team knows about you, the better care you're going to get. And that was what you just told me was really consistent with that. The longer that you've had to interact with the healthcare team at Mount Sinai, the better care you're going to get. And that's probably true for all of us.
Yeah. And I think that's one of the really wonderful things about the Rowan Center is that there is that constant speaking to each other with different healthcare physicians and clinicians about your own healthcare and what your health needs are. Can you talk a little bit about how you see that happening in the Rowan Center?
I think the continuity of all the doctors under one roof and that you have those established relationships. You'll go from room to room. You'll probably know the different doctors that you're seeing, and it's the convenience and also the luxury of having everybody under one roof.
Yeah. So maybe we can talk a little bit. We talked about the different doctors under one roof. What are some of the services? Maybe, Anna, you want to tell us what some of the services are that we're showing in the center?
This is, we're so excited to, again, bring these services under one roof, because even if you go to one healthcare system, often your cardiologist, your endocrinologist may be on 2 different sides of town or in different buildings, and it's not so easy to necessarily find that office or schedule an appointment. Here, we're bringing it all under one roof, literally. So we're going to have some of the usual services that you would find in a women's health center: obstetrics, gynecology, all the usual gynecologic subspecialties, including surgery, urogynecology. But we're also putting in expert menopause care, sexual medicine. These are things that are not often found in centers like this. Endocrinology, cardiology, gastroenterology or GI, specifically seeing GI health through the lens of women's health. Just as an aside, for example, somebody with pelvic pain and endometriosis, these women often will have coexisting GI issues that can be solved at the Rowan Center. And because we're looking at things through this integrative health lens, we're also putting in pelvic floor physical therapy, behavioral health will be there, and nutrition. So super excited about that. One-stop shopping.
Nowhere else in the city, probably nowhere else in the tri-state area, nowhere else on the East Coast,
maybe
Midwest,
nowhere else in the country.
Nowhere else in the country. Do I know? I mean, we all go around to different medical centers. Nobody has coordinated care. And, as you age, your care requires multiple dimensions. Otherwise, it's just too siloed, and it's just not as efficient or as continuous as it should be. And I think that's the awesome point here is, you'll get what you need, and you'll have the attention of every specialty that you need, which is awesome.
And the specialists that understand each other. 100%. I think that's another really special thing about the Rowan Center is the healthcare providers all work as a team and understand what everybody is doing with the patient.
And, I think also what is so unique is the culture of the center, the culture of the people working there, the culture of the clinicians, the people greeting you. How did you think about that in terms of wanting the kind of space you wanted it to feel like?
I think it evolved. I think it started out clinical, looking, and the more we sort of dove into what looks like a hospital, sort of we were like, I don't know. How do we make this feel like a luxurious dressing room? And wouldn't it be nice if we walked into a space that had a glow and just sort of like put your anxiety at bay because it's a soothing atmosphere that feels like it's been designed to make you comfortable when you walk in. And I think we're still working on that. We're still trying to perfect. When you're walking into doctors' offices, you're often nervous. They're going to find something. You have to discuss something. You're going there for a reason. Like either you have an issue or you're worried about an issue. Like, how do we put your worries at bay? Well, it starts with when you walk in, that there's somebody there that's greeting you with a smile, that they're happy to be working there, that they say hello to you, that they look up, that they make eye contact. Every point of contact with you is a chance to build a relationship, but also make you feel connected to the space and also put you at ease.
Yeah, it's so important because going to a doctor's office, you're really nervous, right? And to be able to walk in and feel like surrounded by people who are caring and greeting you. It makes I could walk into a bad analogy. I walk into a store. I'm going shopping. If somebody doesn't come up to me and say, "Can I help you?" I'm like, I don't know how to pick the clothes out. Like, I need somebody to pick the clothes out for me.
I'll shop with you anytime.
Yeah, I'll need you too. It's honestly,
my specialty.
Yeah, I started wearing high sneakers because of your sneakers. But yeah, I mean that's the feeling. And today we were in the center and we talked to a patient who was like, "Oh my God, the experience here is incredible. Like, I hadn't seen it."
Some of this is even backed by research. There's some really interesting data about what makes a healing environment. And, the Rowan Center is a center of ambulatory care, meaning people come in, you come in for an appointment, you leave. But the idea of a healing environment actually continues through settings like ICUs and operating rooms. And we know that the presence of a certain type of light, music, the behavior of the healthcare team, the color of the walls,
the scent.
All of that really contributes to a certain type of experience. And we're there, after all, to partner with patients to help people stay well and be well. So, thank you.
What you brought on, what you brought out about the research aspect of it, I think it's also important to mention that we're doing, besides offering these amazing clinical care that we are, we're doing research in the center. So, Leslie, maybe you can talk, you're an amazing researcher, head of the Blavatnik Family Women's Health Research Institute. Tell us a little bit about some of the top research projects that are going on at Mount Sinai in women's health, but also what you see that we'll be doing in the Rowan Center.
Well, the overarching, I'll start from kind of the 30,000-foot view, is to really look at strategies for prevention, early detection, and aggressive, intensive early care of patients to avert long-term problems. So we're starting with, we have a very large project right now to look at pregnancy complications. It's led by Chelsea DeBolt and myself and many others to look at the relationship with adverse pregnancy outcomes using artificial intelligence techniques to predict long-term outcomes, long-term chronic diseases. Layered on top of that is a focus not just on cardiovascular disease, which is my area of expertise, but any kind of cardiometabolic condition, including cancers, endometrial uterine cancers, which are often obesity or insulin resistant connected. So that's just a broad scope of factors that start when you have your first pregnancy or your pregnancy anticipation and planning, all the way through into your 60s. You know, there are many, many other facets to that we're doing. There's a focus on looking at women particularly have smaller arteries, smaller vessels. This is mine and Fanny Elahi, who is a neurologist's area of expertise, and often those vessels are insufficient to feed whatever they're feeding. It happens during pregnancy to feed the baby. The blood vessels can become thick and stiff and cause hypertension. Same thing happens as you age. And so we're looking at that connection between cardiovascular disease and Alzheimer's disease. That's probably the hardest project we have going on right now. But there's nothing wrong with hard, right? It just makes us try harder. And I think there's just a whole array of other pelvic cancers that we're looking at. Endometrial cancer, we just started a project on with Sharon Holtzman, who's a gynecologic oncologist. Chelsea DeBolt is doing a lot of work, like I said, on pregnancy complications as it relates to all long-term outcome, particularly menopause. And then we have anything related to aging, anything related to, and that could be aging from age 38 to 45. It could be aging from 55 to 65. All of those aging processes, we have different projects and of different sizes and of different funding levels that we're working on. But the goal is to really create a new strategy for early detection of chronic diseases that we can avert those. For example, if you treat obesity in a 30-year-old, they gain weight after pregnancy. You see it all the time, and they don't lose it. And they gain more weight, and they gain more weight. If we treat that and we get them to engage in healthy activities, don't we have the possibility to reduce their risk of diabetes, to reduce their risk of hypertension, to reduce their risk of cardiovascular diseases, to reduce their risk of many cancers that are particularly obesity related? Isn't that an awesome way to really create wellness for women? I mean, that's really the core of what we're trying to do on our research portfolio.
I love that. And it's so in line with what we're doing in the center. I mean, we've talked about some of the gaps, right? Some of the gaps in research and what we need. And we're going to have an overarching IRB for patients to sign up and study what we're doing, the healthcare delivery that we're giving them, and can we improve that outcome? Because prevention is everything.
Well, I think it was from Leslee that I learned that if you had gestational diabetes when you were pregnant, postmenopause, you have a higher propensity for heart disease. And so if we actually link all of the different stages of your life, we can actually get in before you have heart disease. I think it was gestational diabetes and endometriosis are markers for things to look forward to down the road. And they're always sort of siloed into separate topics, but nobody's ever really putting it all together. So it's interesting to have the continuum of if you came in your 20s or 30s, whatever decade you join us, you'll have that continuity of care and hopefully prevention.
Yeah. Yeah.
I think that's, so important to kind of have this mindset shift about how we approach health and illness. So, truth be told, at the Rowan Center, we will be taking care of women with specific diseases and illnesses that we can help with as well. But so much of the effort will be geared towards prevention. traditionally, we often don't intervene for red flags that are actually really meaningful, right? So this is our effort there will be to focus on identification of those early red flags and intervention, including lifestyle intervention, so that we can change the progression of that process. As one of my patients put it recently, like if the train has left the station, now it's the time to change the tracks and not wait until you arrive at the wrong destination. I think that was a really great analogy, and I'm so excited to be part of this change there.
I love that analogy. Yeah. That's so perfect. And that really is like a lead into what is a defining feature of the Rowan Center, which is the MyPath pathways to look at people at different transitions in their lifestyle. So maybe we can talk a little bit more about the pathways. And we're launching, already did launch, the first pathway, MyPath.
I'm so excited. I do a little dance every day.
Yeah. And today we have we opened up, 4 days ago, and we have 20 patients signed up for this. It's
very exciting.
Awesome. So maybe we can go over that a little bit.
Sure. So, I think people are used to getting care the usual way, which is you make an appointment, you think you need to see a cardiologist, you make an appointment, you have that appointment. So, and then care becomes kind of, maybe it's planned, but it's still...
You forgot. You make an appointment, and then you wait 8 months.
Yes, that's true. That's true.
That's true.
And things may not get super connected. So... At the Rowan Center, while people can access care in this, we're calling this a la carte way, can also access care through a program of clinical pathways that we're calling MyPath. And what they are is they are basically timed and guided care experiences that are composed of multiple specialties and that unfold over time. So let's say you take a 45-year-old that cannot sleep, her moods are changing, her weight is changing, her blood pressure is rising, she now is developing insulin resistance, many physiology-based symptoms that happen in midlife. That patient often meets with somebody for 15 minutes and things that cannot be solved in that time frame. So we're turning that around and welcoming that patient to experience care over 6 months that's composed of lifestyle interventions such as nutrition, activity counseling, attention to behavioral health, hormonal management, cardiovascular risk identification and treatment of things like metabolic dysfunction, insulin resistance, prediabetes, weight management, and so on. So after the 6 months, which is a pretty coordinated and intensive care experience, our aim is to make that patient feel better now, but also help her understand her health now and for the future and intervene in a way where her future risk is reduced. And this is just the first one we're getting started with.
Right. It's fascinating to think that you might be knowing what you're going to go through before you go through it, as opposed to isolated incidents where you're like, my sleep changed, but what does that mean? My mood changed, my skin changed, my hair changed, I have more veins, like all the things, like those are like not like big things, but my mood changed, my sleep changed.
They're big things though, right? Like,
they are big things.
And you sort of say, normalize it, right?
I've got to get on with my day. And you don't think there's something that can be addressed. So it'd be really interesting to think about knowing that that's going to happen and that it is being addressed and it is a topic and it's being normalized by being spoken about.
One of the things that, Carolyn, I've heard you say this 2 or 3 times, is to really optimize where you are at your stage in your life, right? So optimize all the healthy activities that you can engage in, make good diet choices. There are many things that you can do and engage within the center to get education, to become more informed as an individual. And I think that is the key, is not to say this is normative, right? Don't accept this as normative because, I have a friend who's a geriatric cardiologist and she treats, very frail people. And she said, even very frail 80-year-old women can absolutely improve what they do every day. And that's always been kind of this barometer to me, is that people at age 45, they kind of give up. Oh, I'm getting older. Well, no, not really. You just need to acknowledge, and there are always possibilities for you to optimize your health at every stage. And I'm just taking your lead from what you've said in the past.
I'm going to tell my mom this weekend when I see her. We'll see how receptive she is.
Yeah. Well, I'll tell my 30-year-old also, because she's definitely not receptive to what I've been saying. You have to exercise. You have to exercise. You're losing bone right now. So yeah, it's like so important that we like pass it on. So to your mom, but also to our kids, right? Like, what do we need to tell our daughters? Our friends with daughters, whatever.
I think it's, as I've done genetic testing, and I now know what my markers are, and I know what I have a propensity for, and I know what percentages. I know that my children have some risk factors based on what I'm learning. So what do we tell them? We tell them, well, we now know what we have. This is what I have to be concerned with. You should probably think about this too. And so if you were to get ahead of bone health, you would know that all the calcium you're going to absorb is by 25, and then you're on the other side of it. Would you try to have as much calcium as you possibly could? Bulk up with calcium. Would you have a calcium-rich diet? Would you actually make it a focus, knowing that on the other side you're losing it? Same way with muscle. Like, that muscle every decade is going down. By the time you're 70, I think you lose 15% more just for being alive. 15% just drops down in muscle. Would you preserve everything that you had if you knew that with aging it's going to maybe go away?
Yeah, and I totally agree. I mean, all this information about building up bone, muscle, your glutes, which are your biggest muscle mass, right? The glutes. I mean, now I have to do squats like 5 times a week. but and balance, right? Like, balance is so important.
Core
right?
strength, yeah, 100%.
I think, Carolyn, what you touched on is really awareness and education. Like, I think a lot of people still don't know certain facts of our own biology because we don't do a good enough job with that. So even for a teenager to understand why she gets a period, what are the various phases, what symptoms may come at these different phases, and how to navigate really very common things that most women deal with at some point. Many women get a UTI once in a while, a yeast infection, this or that. How do you deal with that, especially maybe you're leaving for college? How do you know what it is when you should seek care, when you can handle things on your own? All the way through, what to expect when you're 50, when so many things, when your body can feel so different compared to how it have felt before.
And I love the fact that it's so inclusive of women of all different ages. I mean, I remember when we first started the conversation, we were really focused sort of on perimenopause and menopause. But then through our discussion, we're like, well, why are we excluding everybody else?
Right. Well, that was a funny evolution, that we were really focused on those sort of, I don't want to call them dark years, but they're the unknown years because nobody's really been bringing them into the light. And then the more we were discussing the 40 to 60, well, the 30-year-old was like, well, why don't I want to be in this conversation? What do I need to know? And how do I live a healthier life? So yes, more inclusive. But then the 20-year-old woman came to us and said, but what about us? Shouldn't we know what we should be looking at? And so we really are crossing all the decades to say, how do you live your best and healthiest life? How do we work with what you have today and make it better?
It's a trickle-down effect, though, right? It's not only you and your kids and their kids, right? And the movement is really on. You're born with a perfect body for the most part, and the key is early on is to preserve that as much as possible, right? To focus on everything that keeps you healthy, and then as you age, is to really try to maintain that to the extent possible. And so it's the 2-year-old that benefits from that focus within the family, and it's the grandmother that benefits in the family. So it really is kind of like this tentacle of network that once you start to orient your life towards optimal health and healthy behaviors, that everybody benefits within your circle. And I think that's really the core of a healthcare system and what it's supposed to do, which is to make everybody's lives better off from a health perspective. And it's to preserve health, right? It's not necessarily to be just this medical center that reacts to people that have had a heart attack or that actually wait till they get cancer. It's to say, well, how can I prevent that from happening? And I think that's really what this opens the door for us to really engage and to make all these novel explorations on how you unfold strategies of care that actually start at age 20 and reduce the risk of cardiovascular disease, diabetes. I mean, I'm repeating this list over and over again, but they are the major chronic conditions. You know, how do we actually almost eliminate that in people's lives? Because there have been studies that show that if you do that at age 20, you can reduce the risk by 80%, all these major conditions. But nobody has operationalized it within a healthcare system. And I think this is where the benefit and the core of the Rowan Center is we actually know how to do this and we can actually do it. And is that just, do you guys agree?
No, I think you hit it right on. This is why this is so exciting. So,
I'm going to say I don't believe any of that just because they said, like, the real lives of real doctors and Mount Sinai. Push back. No, I'm just kidding. Totally agree with everything you just said.
Well, it's great that we've got the greatest doctors and the greatest researchers, that we can actually have all the real information and we can share it with everybody. Like, that's the gift. The center's just like the place to get it done. But we do have the best doctors, not in the city, not in the country, probably in the world. Like, we do have all that information. We can put it all together. That's where it's really exciting.
And it's really the putting all of that together. And it does take, a large team of people and resources and a vision of somebody like you, Carolyn, to put that together. I usually tell stories, so I am going to fit in one story. I saw a patient, and she has agreed to share her story here that illustrates why we need a center like this. So this is somebody that came in from out of state officially for a consult on perimenopause. And her primary complaint was fatigue. She was so fatigued and she felt so depleted that she stopped seeing her friends. She stopped seeing her family. She thought she would need to quit her job. And she thought it was all due to perimenopause. So she did access hormone therapy, had been on it for 6 months, didn't do anything. We talked and chatted for a while. It turned out she still has periods that are very, very heavy. And she has iron levels of 9. That is a very, very low level, to the point where she's having, in addition to fatigue, palpitations, hair loss. And in our conversation, she was winded sitting in front of me. She had seen a cardiologist at a different place from her gynecologist, who suggested that she eats spinach to correct her iron. By the way, there is not enough spinach grown in the world that can raise your ferritin of 9 to normal levels. And hormones, she may benefit from them, but that is not the primary thing she needs. This woman needs to be treated with iron infusions to correct her iron deficiency and take care of the underlying problem, which is heavy bleeding due to fibroids. Mm-hmm. And her story is such an example of how people don't access coordinated care, where the single most important goal is to help that patient feel better and understand what's happening and make her feel better now and in the future. And I think this is why a center like the Rowan Center comes in with a different framework of action and a different plan. So
I mean, that's such a great story, and it really does tell the story of the center.
And it's totally, every single thing I said is totally real, and I'm very grateful to her for agreeing to share that.
Yeah. But I want to add another layer to it, because you can have a center that addresses all this, right? Like, we can put great doctors and have all these great services in there. But this center is different, and, you're a designer, and your keen eye for design standards is so tremendous that it is spectacular. So maybe, as we were going through all this, you looked at something and said, well, I don't like this, I don't like this knob, or I don't like this garbage can, so tell us a little bit about
The process?
the process and the process and your sort of what your vision was for what you wanted the center to look like.
I think that was an evolution. I think it was a lot of what we didn't want, and we knew that was just very institutional looking and felt like what you'd expect a hospital to produce. And I think as a women's center, it needed to reflect, where would I want to go? Where would I want to walk into? What would my friends like? I mean, the funny thing is about women is that we share information. Like if I discover a new food, a new vitamin, a new cream, a new book, a new show, I think we tend to share information. So I think if we create a space where women want to come and have their doctors and be seen, we're going to share that information. And I don't think we have to worry about PR, because our best PR will be, I had the experience, it was life-changing, everything I needed was there, and I had a unique experience, and I felt seen, heard, acknowledged. I had the best care.
Yeah. No, 100%. But I also have to say, I had so much fun going shopping for furniture and fabric with you, because I like this, no, this one, no, pick a different one. It was and instantaneously, it was it was perfect.
I felt like I was overwhelming to every team.
Yeah, no.
I was like, they don't know I'm really a contractor on the side. Yeah. I know I'm walking through with a punch list for the GC. I'm like, I see the crack, I see the dust mite, I see everything everywhere. It's hard.
Awesome. It would not have the look, honestly, without.
Even when we were installing things, I'm like, the light's too low, the shelf's too low, you have too many knobs on a row, I can't put art on that wall. I'm sure I drove those people crazy. Paul's very nice, by the way.
No, but listen, it was because of your attention to detail and the way that, this whole team worked together to make it what it is, really. It's it's really so spectacular.
Yes.
When you close your eyes, right, when you say, I'm going to think about what a doctor's office looks like, right, and it's not like that at all. It's like the antithesis of a doctor's office. I was on a call last night. I'm a journal editor, and the pictures have gone out into social media, and I work in cardiovascular disease, so I'm usually the only woman in a room of 20 or 30 or 40 people, and so there were all these guys who were saying, how did you get that? It's so beautiful. How did you get that by administration? They never let me do anything. And so it's just so the antithesis, and it just looks like, something that is just so welcoming. And it's just awesome what you've created. It's amazing. And people all around the world are commenting. I've had emails from everywhere about the pictures, Germany, et cetera. They're saying, that's really awesome. I need to come visit. I said, absolutely.
It's a great space. It is a women's health center, and I would say the majority of people working there are women. I do think we also, part of our health is health at work. And the work environment, and that has to do with culture, that has to do with feeling supported, that has to do with being respected, and it also has to do with how we feel in the space, and feeling well in a space that's well designed and conducive to that positive work environment is important. So I think it's all part of wellness and health as well.
Great. So, talking about wellness, what do you think every woman can do today to feel a little bit better? I've heard you. I think I know what your answer is. You say it.
Okay, well, I have a few. Okay. I think exercise. Exercise takes you out of your daily environment, and you're focused on something entirely different. And there's breath work, there's your mind, there's your body. There's like a whole mind-body thing happening that's just different than the rest of your day. And if you're willing to wake up earlier and carve the time, because it's hard to fit into everybody's normal packed day. I wake up at an unusually insane time so that I can have that hour, but I now depend on that hour. It's part of my mental health. I know that I'm going to benefit from it all day long. I know my body's going to benefit, but I don't even do it for that. I actually do it because I feel like it's a chance to sort of decompress from the rest of the world. So things I think everybody could do: walk faster, jump rope, deep breath work, meditation, eat differently.
Yeah. Those are all things that are immensely doable that we have to get across to our friends, our patients, our colleagues. Because I do think we don't, sometimes take enough time for ourselves. And yet, you're busy, you have to get, I don't know, what time do you get up, 4 o'clock in the morning?
No, a little later.
Okay. I do get some 5 o'clock in the morning texts.
4:30.
Like, I think we need to do this. Karen's already up and doing exercising.
I think I'm going to just type them all out and then send them at 7 going forward so people don't
I'll
know
be
my
up.
real
No.
schedule.
I'll be up doing my exercising to get my bone and muscle mass up. But I think you're right. And I need to practice meditation. I don't know if you guys do it, but I tried and like my mind just spins. So I need to practice that a little bit more.
People sometimes are intimidated by the name meditation. Like, I'm a terrible meditator.
No, you're not.
I can't. But I walk out in nature, and that is my form of meditation. That is how I relax my mind, and that's okay. And I still practice meditation, but it's not something I'm good at. But I think there are many different ways we can have that mind space and we can access it. And I agree, Carolyn, I think that's super important. That's one of the things I wish I have done more of in my life.
92% of Americans don't do what we just talked about over the last 2 minutes, something like that. 92%. And that's really sad. And I think there was some critical information, Carolyn, that you said, is you figured out in your day what did you need to do to orient it. I've also figured out that getting up earlier is a good solution. It's quiet, nobody's awake, but everybody in their own life needs to figure out what it is. Walking around the reservoir in New York City, to me, is just, it's amazing, especially early on in the morning. Not eating too much salt, almost 100% of Americans eat too much salt. So there are things that anybody can do, small changes. We're all in New York City right now, so saying things like, parking your car far away is probably not relevant. Walking, if you only have to take one bus stop, walk. If you only have to go up one flight of stairs, walk it. Anybody can do anything to make a change that leaves them better off at the end of the day. And I think that's what you just articulated for us, which was awesome.
Breathwork is really interesting also, that you could reset your cortisol levels by learning how to breathe differently. And think about somebody who has a high propensity for high blood pressure. Just think about the average person going to work in the morning. You're on a bus, you're on a train, you're anxious, you don't want to be late, you're next to somebody who coughs. Like, there are so many times in a day that are stressors. Just waiting online for something is a stressor. Listening to somebody, what do you do with that time? How can you use that time to focus on something else?
Yeah, I was thinking as you all were talking about, it's not necessarily the meditation, but maybe it's an activity that you love that takes your mind off of the stressors in your life. So for me, like, I put Chopped on and I'm cooking. On a Sunday afternoon, that's my thing. So I put Chopped because I don't have to pay too much attention to it. I'm not cooking the recipes. I'm doing my own thing. But I don't have to. I'm not thinking about work, and I'm not thinking about other aspects.
I think you have to prioritize yourself.
Yeah, definitely.
As opposed to social media or something that's filling just the airtime because it's there and it's accessible. It's not necessarily enhancing your day in any way.
So as we think about prioritizing ourselves, what do you think you would tell your, 20 or 30-year-old self that you know now?
What would I do differently?
What would you do differently?
I have to think about that. What would I do differently? I think I always really liked exercise. I think I always really had a good diet. Probably not to worry. I probably spent a lot of energy on worry, and I think we all know that that's a future thought. And so getting your mind back to, how do I be here now?
Yeah, I like that. I like it a lot. Leslee, what about you?
I think I've answered this a couple of times, but I'm going to give you a different answer. So, my goal as a scientist is to leave the world a better place. That's what I knew I could do that. I think that the healthcare system has been and is in a tenuous place. I think to be confident that there is always something you can do in the world to make it a better place for patients and to make this society healthier. And I would be more confident of that as a 20 or 30-year-old, as opposed to just having can I make that happen? Can I really do that? And so I think that I would be more confident. And maybe if I was more confident earlier on, I probably would have done more, but it's hard to say.
I think you've done a lot.
I think you've done a lot.
I think you've done a lot too.
I think you're
Totally.
already leaving us all in a better place. We have so much more
Good.
real science behind how we see things.
Awesome.
Yes.
Day's never done, though, right?
Yeah. That's forever.
Anna, what about you?
Are we talking about health stuff or general
Anything, 'cause
stuff? Okay.
Anything general that you wish you knew, when you were 20, or some
Okay.
advice that you would give?
Well, while I had some, questionable hair color choices, I think, in this now that I'm over 50, I have the luxury of having this lens of a long arc, looking back. I think I wish I was more confident in my beliefs and values, many of which I still hold, and didn't worry so much about what other people said. And I wish I spent time being less busy than I was, between running around, checking off everything, worrying about what other people thought, and thinking I had to do certain things that I really didn't have to do, and spend some time really thinking about what was important and focusing on those things. And I think that, again, having the luxury of some decades on me, that's something that I'm better at now, and putting my energy into projects that I think are meaningful and will carry meaning for others. So,
Joanne, your turn.
I know.
Okay,
exactly.
well, I was first going to say, staying out of the sun, because as I deal with my basal cell carcinomas, it's, something. But what actually, I think if I could tell myself or done something differently, it would have been to do more acts of kindness. Really.
You're a doctor. You've done nothing
You do
but
acts of kindness all the time.
But on a different level, like a very personal level, taking care of patients is one thing, but just acknowledging, saying thank you, just showing your gratitude towards other people in your lives, whether it's somebody that you work with, saying hello, thank you for what you're doing, whether it's, to the doorman in the building, whether it's to your children or your husband. My husband would say, yes, you should be kinder to me, for sure. But I think that's really something that, I could have done better, and I would tell myself to do differently.
I think you're doing a great job today.
I think so too.
By the way, I'm just so incredibly impressed by the people I get to keep company with, and you're amazing women.
Well, this has been,
Likewise.
yeah, this is like the total girl love group, I think, it's just been amazing. And really, we're so grateful to work together and work with you on this
Thank you.
incredible
100%.
center that's going to change women's lives.
That's what we're
it
here
will
for.
change women's lives.
Thanks
good.
for making
Thank
it
you.
possible.
Thank you.
Thank you all. So that's all for our episode of HERology. I'm your host, Dr. Joanne Stone. Subscribe to HERology and the Mount Sinai Health System's other video podcast programming on YouTube, Apple Podcasts, Spotify, or wherever you get your podcasts. To learn more about the Carolyn Rowan Center for Women's Health and Wellness, or to book an appointment with a Mount Sinai expert, scan the QR code on your screen or click the link in the description below. To get in touch with the show or suggest ideas for a future episode, email us at podcast@mountsinai.org.